So welcome to the Queen Elizabeth Patient Podcast. We have a podcast today discussing clinical research studies. We have our Gynaecology research nurses, Lorraine Pierce and Lucy Blackwell, to tell us a little bit more about it.
My name is Lorraine Pierce and I'm the Gynaeoncology research nurse. The cancer research team includes Lucy Blackwell, the clinical trials officer, who we'll be speaking to soon, a Dr. Maria Beccari, clinical trials officer, and Wendy McCormick and Caitlin Berry, both data managers. The role of the research nurse is complex, interesting and exciting. Research nursing is at the forefront of new developments in treatments for patients. We hold numerous responsibilities in recruiting patients to research and the running and management of studies, ensuring patients feel safe, protected and well supported throughout their research experience. The trials we currently have open to research in Gynae-Onc are as follows. RANGO. RANGO is a study of specified rare gynecological cancers to facilitate a greater understanding of disease progression and response to treatment. PROTECTOR. PROTECTOR is a research study for women who are at an increased risk of developing ovarian cancer. Some women may carry a fault, alteration in their BRCA1 or BRCA2 gene, making them a high risk, whilst others may be at an increased risk due to a strong family history of cancer or a fault in another ovarian cancer-causing gene. MROC. MROC is about MRI and diagnosis of ovarian cancer. And then ROCKETS and ROCKETS Gen, studies looking at current tests for ovarian cancer to help improve diagnosis. And finally, CLOCKS. CLOCKS research project aims to investigate whether or not women have distinctive self-management behaviours prior to seeing their doctor with symptoms that are associated with ovarian cancer. I'm also the Cancer Clinical Research Lead for the Trust. This role is to increase the awareness of cancer research activity in our hospital and building on our research interests and priorities for the benefit of our patients.
Hi, I'm Lucy. I'm one of the clinical trials officers for cancer. So I'm mostly involved in setting up and running of the cancer studies across the Trust. We've currently got several cancer studies which are open, including Optima, which is a personalised treatment of hormone-sensitive early breast cancer. And the aim of the study is to take the tumour sample and run it through a test to see if those patients need to have chemotherapy or if they can just have hormone therapy. We have SMP2, which is a cancer research study in lung cancer, which also tests the genetic makeup of tumour samples to see if it can lead to better treatments for patients in the future. And we have AdAspirin, which is a double-blind study to test if taking aspirin regularly after treatment for early stage cancer can stop or delay the cancer coming back. We also have several hematology studies and many others that are in setup. So I act as the contact between the research team and the patient, and I'm there to support the patient through the journey in research, sort of explaining studies to them, answering any questions they might have, organising their appointments, collecting samples, doing questionnaires with them, and just making sure that those studies are run within the protocol, because studies are quite tightly regulated.
So a lot of patients will ask about how do they find out about what's available in their area of care. What's the best way of doing this?
So the best way is when they're attending their consultation, whether it be face-to-face appointment or on the phone, you please, ask your clinician if they're aware of any relevant studies that you could find out more information on. Alternatively, they could always contact our local research and development department at the hospital, who will be able to signpost you to the correct person that you need to speak to. There's also a website called Be Part of Research, where you can search for study-specific information to a condition.
So what would actually involved in taking part in this research?
So all research studies are designed differently and depending upon what is being researched. If you are identified as being suitable for a particular study, you would be given a patient information leaflet to read at your leisure, as well as time to discuss this with your family, friends, and also your GP, so that you can then go on to make an informed choice if you wish to participate. What's really important is that it's the patient's choice, so they should never ever feel like unsupported. The whole process, you'll be feeling very supported and making the right decision to participate or not. The research team will go through what is asked of you so that you are fully aware of all activities before signing the consent form. Patients always have the option to withdraw from research at any time. An example of different research activities include blood tests, extra scans and questionnaires. Some studies also have pre-screening. You might have to undergo some screening assessments which could involve scans, blood tests, observations to ensure that you meet the inclusion criteria set out by the study protocol. You may have to attend for regular follow-up appointments. The type and frequency of tests may vary according to your research you've taken part in, but this will all be explained in the patient information sheet and by your research nurse or your clinical trials officer. You may want to get involved in research to want to learn more about your condition that affects you, to make a difference, helping to improve treatments and quality of life now, but for also future generations, access to new treatments, and take an active role in your own care.
And I think one of the things that some patients will ask is about what happens with the personal information. Could you give us a bit more information about that?
Yeah, so your personal information will be treated as completely confidential. In the majority of studies, patients would actually be assigned a unique code, and that's the only thing they would be referred to. If there's any sort of personal information that needs to leave the trust, like some studies might ask for an NHS number, that is clearly stated on a consent form, and patients would have to sign to say that they were happy with that. And obviously we abide by all the trust regulations about data protection and confidentiality.
Oh, that's really reassuring. Would the patient be able to find out about the results of research that they participated in?
Yeah, so again, a lot of the consent forms will have on, would you like to be contacted with the results of this study, and patients can opt in or opt out. But obviously for cancer studies, it does take a long time for those results to become available, so it can take up to 10, 15 years for them to become available.
Oh, that's great. Thank you so much, ladies, and thank you for that. I'm sure it'll help a lot of people want to know a lot more about clinical research and the trials that we're offering at QE Hospital.
Thank you.